I'm sure you've heard this, I've heard this, is,
Mhm.
no, CVS will go away. What are your feelings on that?
You want to always, give people hope, and I think there are a lot of treatments, obviously. I think the expectation that CVS will just kind of go away on its own is probably not accurate. This is a chronic condition. I think we need to be honest about that. I think it can be managed, and I think we can often manage it pretty well, in a lot of patients. So I think the message that this is just going to go away is probably not a great place to start. But I do tell patients that I really think we're going to be able to make a difference, because I'd never set up patients to expect that you'll never have an episode again. I don't think that's realistic. There are some patients that have amazing responses to some of these treatments. That's true, but that's not the majority. And I think most patients do get um, uh, improvement with the preventive medicines that we use. Um, I think often aiming for at least a 50% reduction in frequency is a good goal, and having access to abortive medications that work most of the time. I think those are really things to strive for. So just even having something available where you could be pretty confident that most of the time you can turn off an attack. I think that's somewhere we can get with patients. So I think the reasonable expectation is that we can have effective abortive therapies that work for you, and that preventative therapies can reduce the length of an attack and the frequency of attack. And moving forward, hopefully we just get it to a minimum. But I think that's the reasonable expectation. Keeping people out of the hospital, I think those are really goals. It's a chronic condition, unfortunately.